Welcome to the 2014 User Summit for Cyton. I'm going to show you a couple of things that actually you can do in your office, but we're doing it in the OR today because we already have an awake patient. She has consented to us teaching and talking about her. What you see is we've already done a mini facelift, and the areas of demarcation are areas that I've undermined. So when we talk about what can we laser and what should we be careful of, at a transition zone where I have facial wrinkles that will actually cross over into an area that I've undermined, I just need to be mindful of that. Oftentimes it won't matter. And I've also marked her upper eyelid where she's had a previous blepharoplasty. And everything above the purple line, I will oftentimes just use some coag and some resurfacing settings like 220 and to get some additional tightening. She's already had a bleph. Her biggest concerns are the lines around her lower lid and that crepey skin. So I've just kind of inked out the orbital margin. And again, this is my area of demarcation. She's awake, but if she were asleep, I would put a shot that we've talked about already. Yeah, if she were awake, I think I said that right. No. If she were awake instead of asleep. Thank you, Patty. The infraorbital block, the supraorbital block, and then I usually block along the lateral margin of the orbicularis muscle anyways, just to give them a little extra help, and it also keeps any bleeding down to a minimum when you're doing your resurfacing. She's already had her face tightened, so you can see it's quite snug. And the reason why that's important is when we go to put eye shields in, if you tighten the lower lid, it makes them very hard to get in, but it also helps with protecting the eye from a laser. So on this case, I'm not going to put in eye shields, but I'm going to be controlling the margin because it would be really a struggle to get an eye shield in that lower eyelid. It's very tight now anyway. But in an awake patient, obviously tetracaine drops, and I'll just show you how to insert a shield even though it might be a little tight.
You want some tetracaine, doctor?
Yeah, let's put a couple drops of tetracaine. Obviously in an awake patient, that's very important. This won't hurt, man. Oh, wait, she's asleep. And then the shield have an inner and an outer and a plunger. And so when you have a tight eyelid like I have with her, I'll tend to ride up first and then ride down. So it's in place to protect her eyelid, or to protect her cornea. So technically now we're going to resurface in the subunit of the lower eyelid, and I don't have any problems going beyond my line, just a little bit to feather, and I'm going to focus kind of staying off of hair, and that's really it for the eyelid. And now for the oral area, we've got a few cases to illustrate, but obviously the sphincter of the mouth, the lines are oriented vertically. This lady's lines are not very deep. But in certain people you'll see lines that actually cross the vermilion border. And what I'll try to do there is go across the vermilion border and get rid of the line first and get a really nice flat looking transition between the colored part of the lip and the upper part of the lip. And then individually, I'll try to hit each line if they're very deep. And then this young lady, they're not very deep. So, again, and then keeping the subunits, because I've lifted her already, this whole area lifted. This used to be her subunit. So as I transitioned up, I'm going to try to keep her laser resurfacing to the area that I've marked so it heals as one particular unit. And then nerve blocks. The good landmark is the pupil, which we've covered, but it's directly above the pupil. And if you have an awake patient, you can actually feel the notch and ask them to tell you where that's most tender. And remember, there are 4 little branches that come off of this. So you just want to put a half a cc little dollop under there. And it helps them when they awake that it won't hurt. You can go in a patient who's needing a block also right below the pupil and about a finger breadth below. You can also put a percutaneous shot right there, right where the infraorbital comes out. And that'll give them nice block after, and then this has already been blocked from my facelift part. So let's go ahead and resurface.